Why do dental implants fail? It's a common question that is asked by the patients. There are several reasons to it. Ideally, a dental implant restoration should last as long as the patient lasts. But I believe the primary factor is poorly fabricated prosthesis, poorly placed implants, unhygienic prosthesis, and then after that, systemic diseases and the lifestyle, like smoking. Are these all preventable? I believe they're preventable. How they can be prevented? One, I think receiving the treatment from a well-trained dentist, well-experienced dentist is the number one factor. Number two, home care. Number three, maintenance by your dentist. If you go and see your dentist every 3-4 months, before the problems rise, he can address those. So if you're interested in learning more, or if you think that you have a failing or ailing implant or implant restoration, please feel free to call us. We'll take a cone beam CT scan for you and your x-rays, complementary, and we'll let you know what the problem is and what we can do for you.